I have Dr. Ekanem Nseabasi with me, a global healthcare specialist. He joins me from Abuja. So my question with you was, how do you think Nigeria can address the disparities in cancer care and treatment?
Okay, I think for that to be achieved, first of all, I think the Nigerian government has done well so far because the Basic Healthcare Provision Fund right now covers cancer. And it covers the cascade of care for cancer in terms of diagnosis and even access to prevention of cancer. Of course, more needs to be done because even with the effort done so far by the government of Nigeria through the Basic Healthcare Provision Fund, there's still that disparity, and we see a lot of people not having access to affordable care and treatment of cancer. I think there's need for both the government at the federal level and even at the local government level to actually demonstrate, that commitment. And I'm glad to say that the Kano State has actually done well in that regard. Lagos State has also done very well. I think there's need for an intersectoral collaboration. Cancer is a very, very highly preventable disease that can be, that can be cured if it is dictated on time. So it's important for the government to put down measures that will help help Nigerians to prevent even the occurrence of cancer. For example, there should be a mandatory screening for all female above the age of 30 for both human papilloma virus and of course Pap smear, which is the gold standard for dictating cervical cancer. And also kudos to the National Primary Healthcare Development Agency through the support of Gavi. All female children right now have access to HPV vaccine, which helps significantly in the prevention of
Dr. Nseabasi, right. Let me quickly ask you this question. I'm looking at numbers now, and it does appear that there's been a rise in the past couple of years in the number of cancer diagnoses in Africa. What's driving that, and what can be done to minimize this?
Well, I must say that the increase in number is because there's increase in diagnosis. A couple of decades ago, diagnosis for cancer was something that was sort of alien in Nigeria. We know a number of cases, post-mortem cases, that were found to be cancer cases, but never got diagnosed. So the fact that you're seeing the increase in the numbers currently is because there is increase in diagnosis, there's increase in awareness. So more people are more conscious about cancer, and they seek care, they seek the diagnosis, and they get to know about their status on time.
Finally, again, before I let you go, what is the best way to raise awareness? Since diagnosis is actually why we're seeing a rise in the number of cases, how do we raise awareness on time?
I think we need to raise awareness by, first of all, engaging young school pupils, because these are the ages where we can easily nip cancer in the bud. It should be mandatory that all school girls should have access to information about cancer. We need to empower CSOs, civil society organizations within the community, to raise awareness about cancer. We need to empower the media. The government needs to fund the media, the national orientation agencies, and all other relevant agencies that can help to promote the message of cancer awareness across the length and breadth of this country. So awareness is key, and we need to also ensure that we engage with the what we call the gatekeepers of the society, the traditional leaders and the religious leaders, to keep spreading the message of cancer in their churches, in their mosques, and in the community. If we do this, we'll be able to get more people aware, and as more people are aware, we'll be able to get more people to be screened early, and we'll get more people to be treated and cured of cancer.
The sticking points here, more awareness, and the churches and the mosques. Thank you so much, Dr. Ekanem Nseabasi, a global healthcare specialist, for speaking to us tonight. Thank you.
Thank you for having me.